Alright guys, so what heart sound is this? Go ahead and drop in the comments of what you think this heart sound is, and today we're going to go over heart auscultation landmarks. Hey guys, my name is Will Kirkpatrick. I'm the nursing educator inside Courseta Nursing, and today we're going to use Courseta VR, the virtual reality nursing simulation application, to go over heart sounds. So we're going to go specifically over the landmarks and what they mean of each heart location. So there are 5 different heart auscultation landmarks, and it is pulmonic, the aortic, herbs, tricuspid, and then your mitral area. Now let's get right into the VR simulation and explain these landmarks. Hey there, Robert, how are you doing?
I'm doing well, thanks for asking.
That is great. So I came in here to do a quick assessment on your heart. Is that okay with you?
Yeah, that's fine.
All right, perfect. All right, so I have my stethoscope here. So are you having any chest pain or anything like that? Any symptoms?
No, I haven't had any chest pain.
Okay. All right. So I'm going to go ahead and listen to your heart.
Okay.
All right, guys. So as we said, there's 5 landmarks, as you guys can see here. So we have our aortic area, our pulmonic area, the herbs point, tricuspid area, and the mitral area. So really what these landmarks are doing is helping you understand what area you're listening to best. So this is called the aortic area, right? Because this is the best way to listen to the aortic valve. So the aortic area is the second intercostal space on the sternal border here. So that is your aortic area. So this is the best spot to listen to the aortic valve. Alright, so then we go over to the second intercostal space on the left side of the sternal border, and it's the pulmonic area, which is your pulmonic valve. So here, second intercostal space on the sternal border on the left side, your pulmonic valve, and then your right sternal border on the second intercostal space is your aortic valve. Alright, so going down is the herbs point. So herbs point is kind of like your centralized location where it's good to listen to the bicuspid and the tricuspid valve. So this is a good spot if you're kind of wanting to centrally listen to the heart. Alright, and then now your tricuspid area. So your tricuspid valve is on what? The right side, right? So it's the separation between the right atrium and the right ventricle. So the tricuspid area is the best spot for that. Alright, and then we have the mitral valve. So this is arguably one of the most important areas. This is called your apical impulse as well. So the mitral area, a lot of NCLEX questions about this. So it's your left 5th intercostal space on the mid-clavicular line. What that means is we have our clavicle, right? So we have our clavicle up here. So it's the mid-clavicular line. So we go just straight down, 5th intercostal space, that is your mitral area. And this is listening to the mitral valve, which is a very important valve to listen to, especially because it's on the left side of the heart. And the left side of the heart is responsible to pump blood to the rest of the body. So that's why that's so important. Now this is the easiest place to also listen to the heart sound in general because it is your apical impulse. It's very strong. Alright, so that is the reason why we have the names for these, because it really just tells you what valve you're listening to. So each landmark is telling you what valve you're actually listening to the best. Alright, now let's answer that question we first asked you guys. So what heart sound is this? Now I'll give you a hint, this is a murmur. So go ahead and drop down in the comments. Options I'll go ahead and give you, is it a S3? An S4, or is a holosystolic murmur? Go ahead and drop down in the comments what you guys think this heart sound is. I hope this video helped you guys understand the heart auscultation landmarks. Now, Robert, do you have any encouraging words for nursing students?
Just keep doing what you're doing.
All right, very good. Thank you guys for watching. We'll see you in the next video.